Assalamu alaikum, dear doctors. In this video, I am discussing a history, inflammatory bowel disease management of relapse. So the scenario is that scenario of a 14-year-old boy with established Crohn's disease who has been referred to the rapid access clinic with bloody diarrhea. So what are the questions we ask in history? Number 1, age at the diagnosis and how the diagnosed. Number 2, how many relapse so far. Number 3, the current symptoms uh, pertaining to the relapse, including stool frequency, consistency, presence of blood and mucus, any abdominal pain. Ask whether the nocturnal symptoms in addition to daytime symptoms. Number 4 is the systemic symptoms, including extraintestinal manifestations, especially the inquire about joints, eyes, and skin. Number 5, evidence of weight loss. Check growth status. You may be shown a chart including height velocity. Number 6 is ask about the pivotal status as this is often delayed. Number 7, previous and current treatment like dietary, medical, or surgical. Ask about the side effects. Number 8, most recent levels of inflammatory markers, hemoglobin and albumin level. Number 8, family history of inflammatory bowel disease or other autoimmune conditions. And number 10 is social history, including effects of illness on family unit and schooling. Remember, potential for considerable psychosocial morbidity. Now, management planning issues that may be discussed. What is the management planning in Crohn's disease, inflammatory bowel disease? So, these are number 1, clinical assessment of unwell child with severe exacerbations. Number 2, the use of markers of increased disease activity, example raised ESR, CRP, white cell count, lower the albumin and hemoglobin, full calprotectin. Number 3 is that home versus hospital management of relapse and threshold for hospital admission. Number 4, discussion of main treatment approaches for relapses, exclusive enteral nutrition, that is polymeric or elemental feeds or corticosteroids. Number 5 is you will need to know benefits versus risk of these treatments. Remember that many patients become corticosteroid dependent or resistant. Number 6, involvement of a dietitian is essential. Number 7, management of gastrointestinal complications of Crohn's disease. Example, toxic megacolon, colonic dilatation is more than 6 cm, abscess and fistula. Number 8, indications for surgical treatment. Remember that over 50% of patients will need an operation at some time in their life. Number 9, further treatment, particularly if steroid resistant and surgery not deemed suitable, to be aware of azathioprine 6, mercaptopurine and methotrexate. If not responding to this infliximab, then adalimumab, that is a monoclonal antibody treatment, can be considered. Carries increased risk for malignancies. This is all about inflammatory bowel disease management of relapse. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.